You recording? Recording now? Okay, hi. Alright, so I want to make sure that I obtain verbal and written consent from the parents. And we're going to talk about all the things for the exam as we go. And so I am going to wash and dry my hands, make sure that the baby is lying supine in the flat on the warm area, free of any drafts. All right. Want to note the baby's APGAR score from the notes, and baby had an 8 and 9 APGAR score. Just talk about the normal tone of the baby's color to the parents. Nice and pink. Earlier saw the extremities were a little blue, and that's normal, but now everything's all pinked up. All right, and so with that, I believe that's everything. We move forward to the vital signs, and so when we do temperature, I know the most accurate temperature is in the rectum, and I remember we talked about 97 and 99 yesterday as a good range. Temperature, when we do respirations, we're checking for any of the grunting, flaring, retractions, and that's range about 40 to 60. We're talking about the heart rate. We're assessing for any heart murmurs. All right. And so, now the baby's out of utero. Normal is like 120 to 160. And then we're going to also palpate the femoral pulses. All right, moving from the vitals, we're going to go to the measurements. And so we are going to, thank you. All right, and so measure baby's head circumference. Where's this baby at? So we got 11. Let's see how close the head and the chest is. Measure at the nipple line. Chest is 9. I think the average for the head is like 13. Average for the chest is around 11. So we got the measurements of the head, the chest. Got to do the length. Maybe about 17 inches. I think normal is like 19 and 21.
Yep.
And then like we would put a not a towel, but like a Chuck's pad in here. Oh, this is.
Nope, they're two different ones.
I'm like, what is going on? And so obviously the Chuck's pad is in there. We gotta tear it so we can zero it out. Turn it on. Beep. All right, so now it's zeroed. All right, put the baby in.
Yep, that's good.
Hey, baby. All right, so we got the baby 7'7". Perfect. Beautiful.
Okay.
Within normal limits. Okay, so now let's do the assessment. So start with the head. Let's palpate both fontanelles, palpating the suture lines. We're going to palpate the plates and assess for the firmness, the position, spacing up, down, their appropriate spacing. We're also going to be, so I said the sutures, fontanelles, firmness in the plates. So we're also going to assess for a caput, assess for cephalohematoma. We're going to be assessing for any lesions and molding. All right, so as we move from the head, we go to the eyes. And so, I know it's not a ophthalmoscope, but we had a ophthalmoscope. We'll be looking for the red reflex. And we will also be looking, I say perla because it just helps me remember pupils equal round and reactive combination of light. I'm saying that wrong, light accommodation. But also looking for the spacing, tracking, shape of the eyes. We're looking for any evidence of jaundice, look for any yellowness, coloration, looking for any hemorrhage of the sclera.
Is it always a red reflex?
Is it always a red reflex? Oh gosh, I want to say you're expecting a red reflex.
In more melanated babies, it's not red, it's kind of a white.
Okay, thank you.
You did that well. Good job.
Thank you. All right, so we're gonna move down to the ear. So I was gonna make sure the parents know that they do need to consult to get a hearing exam done. And they go to the pediatrician because we do not have the equipment to do that here. And so we are going to be looking at the attachment, area of attachment of the ears. We're going to look for pre-auricular tags, tags. Looking for firmness of the pineal, looking at the external structure of the ear. Is that it? Okay. So moving on from the ears, look at the patency of the nose, one nostril at a time. Baby's breathing fine in and out. We're gonna move to the mouth. So with the mouth, we are looking at the tongue. We're looking for the size of the tongue and the position of the tongue, and as well as the frenulum under the tongue. And so I'm also gonna palpate or inspect the baby. It's nice to us look for the hard and soft palates with a gloved finger. Check for sucking and swallowing. I also noted that as it was breastfeeding earlier, that does have sucking and swallowing reflexes. As we move down to the neck, that was all for the mouth. As we move down to the neck, we are checking for any abnormalities, like any webbing, clefts, pits, masses, assessing the clavicle, make sure that nothing is broken, check for range of motion. We are now assessing the chest, and so we're making looking at the breast buds position and the size. I really feel like, are we supposed to measure from nipple to nipple? I don't know why I feel like we're supposed to measure from nipple to nipple. I don't think it's on there, but for some reason I want to measure from nipple to nipple.